Meet Dr. Mark Berkowitz.
Dr. Mark Berkowitz
is Dr. Berkowitz.
Dr. Mark Berkowitz. Dr. Mark Berkowitz.
Dr. Mark Berkowitz.
Dr. Mark Berkowitz with Accent's Cosmetic Surgery.
So first of all, the consultation is very important. I spend a lot of time with the client, and then we replace one graft at a time to create a beautiful new hairline for people. This will give a natural look, and this does help to tighten the skin. The beauty of this laser is that it can be pointed toward the fat to melt the fat. So number one, you must use it, and you must use it every day. Number two, you have to use an ample amount, and that usually means 1 ounce. And especially men, as we get older, it occurs we get hair from our ears and noses. We don't want that hair.
Welcome to Accent Your Beauty. I'm excited today because for a change, we're not in our studio. We're here live at the office with Dr. Mark Berkowitz. We just heard your name 100 times, so I think everybody here knows who we're sitting and talking to. You're an award-winning cosmetic surgeon as well as an eye doctor. You've done, I heard this, I haven't seen them all, but I heard you've done over 10,000 procedures.
I've done well over 10,000 procedures in the past 2 decades.
That's a lot. You've worked on a lot of people.
A lot of happy people.
I'm sure. And I'm sure it's not 10,000 people because some people have more than one procedure.
So some people have more than one procedure, but if I'm going to count that, I may be up to 20,000. So
okay, well, I count myself as someone that's had more than one procedure and proud of it.
You look great.
We've figured out that there's no longer a stigma to having something done to make yourself look better. It's not something that you hide, it's something that you share with your friends so that they can enjoy the benefits also.
Yeah, I mean, it's pretty amazing. Really, cosmetic surgery has changed dramatically. Where it used to be hidden, now it's out in the open. Thank you, the Kardashians. And they've really made it that it's a badge to wear, and people are happy to show it on social media and other areas too. And you know, it's really exploding. And I first, even before that, want to just thank everyone who's here, because they've helped. Those 10,000 people have helped my practice to help other people. And I couldn't do it without my staff. And so I'd like to show the first slide. So again, this year we were just awarded from Aesthetic Everything numerous awards for my staff and myself, from top hair transplant surgeon, top body contouring, top estheticians and RNs, and it's really, any of you who know my staff, I'm just so thankful. And this is something that is like the 5th year in a row. And for those of you who don't know Aesthetic Everything, it's voted on by 250,000 people in the industry. And so we're quite proud of the effect that we've had, not just on those 10,000 people, but their families as well.
And I've been, well, go ahead, clap, that's worth it, right? And I've had the opportunity to meet the staff, and I can honestly say, this is the nicest group of people. They answer your questions about everything. They make you feel comfortable, and they explain what you're getting done. And that's the whole point of it, is to understand what you're doing and what's being done to you. So
it's all about education. And so my staff is great at that. They know how important it is to me that you understand everything that's going to happen for you. And so today what we're going to do is we're going to take an overview of some of the newer procedures. So let's get started with the first slide. So Joan was a lovely lady, and she brought cosmetic surgery into the realm. But she had some looks at times that people didn't necessarily love. It wasn't the look of, wow, that's great. It was like a double take at times. And you know, what did she do? And that's not what we're shooting for. What we're shooting for is a natural look that people just look at you and say, wow, you know, did you just get back from vacation? Did you have your hair done? It's your makeup, but not, she looks plastic. Boy, because my name is on your face, I want you to look natural. And so that's what I shoot for constantly.
And you can see there's a lot of things wrong with whoever did her, because that's someone who's overdone. Does anyone think that's a great look? No. So Dr. Berkowitz did not do any of that.
I put our collage together. Next slide, please. So, everybody says, I want to age naturally. No, you don't. No. So here is one of the most beautiful women in the world who decided to age naturally, Brigitte Bardot. And so here she is in her 30s and then later on in life. And she aged naturally.
That's not a great look. I think that it's better, rather than aging naturally, age gracefully, right? There's a way of doing it. I mean, that chin would bother me, right? That chin would bother me. Her eyes, right?
Oh, yeah.
So there's things that could have been improved, but maybe she got tired of being a sex symbol and she's happy just getting old and looking like that. I think you could do a lot with her.
So when you watch our show, the last 15 minutes of every show is celebrities. And Jackie and I and another host will look at celebrities and look at the work that they've had done, and we will pick it apart, the good and the bad. So you watch for our show and take a look at that. And it's every Wednesday night on New Radio Media at 7 p.m. But because it's on the internet, you can watch the older shows at any time. Let's look at the next slide. So, looking at this slide, I have people who come to me and they say, Dr. Berkowitz, I know you have all this different equipment, lasers and fillers and surgically, I've heard you do these great things. And so I need you to turn back time for me. And so this lady comes in and then she shows me the picture of what she wants to look like. Let's take a look.
Oh, yeah.
So I have to talk to her. I have to sit her down and explain what we can do, what's realistic, what's not. And that's part of the whole education process. Because you can turn back time, but not this far. So this is one of my favorite slides, although you may not like necessarily looking at it. But when I see someone's face, this is what I'm thinking about. I'm thinking about some of the lost volume and, areas that have sagged. You probably say to your kids or grandkids, put that back where it came from. Well, that's what I'm doing. I'm putting things back where they came from. So when things sag, I lift them up. If you lose volume, there are a lot of different ways I can give you back volume, and that's the majority of what we'll end up talking about today. And then we can tighten the skin, but with tightening the skin, we could do it from non-surgical ways like thermage to surgery itself and everything in between. And there's ways to lift and tighten without getting a windswept look. You don't want to look as if you've had a procedure. And so since gravity pulls things down this way, I don't know why many other doctors pull things this way. It should be pulled back up. And so that's what I do in the procedures that I perform. Next slide, please. So fillers are really our future. And I'm more than happy to bring people to the operating room. It really does make a beautiful change. That's a very natural looking change. But many people don't have the downtime to go to the operating room. And so they come to me and they want a procedure now, and they want to see the results.
Instant gratification.
Instant.
Right? We don't want to wait. We want to fix what's wrong, and we want to walk out looking better and younger. And that's the beauty of fillers. That most of them, Botox takes a few days to show, but most fillers, you'll walk out looking a lot better. I think something that we touched upon that we should kind of reiterate is realistic expectations. You can't go in and expect to turn back the clock that far back. So if your expectations are realistic, that you want to look more rested, you want to look, the key being good for your age. You're not going to look 20 again, but you can look like a really great 60 or 70.
And go out there and really within a day or two be more than presentable, but look great. And so with these fillers, you can do that. And so there are fillers that I'll mention, but really all the fillers that I'll mention, I can use almost any one of them. The real decision that you need to make is short-term filler or long-term filler. How many of you know that there are long-term fillers? Yeah. So more than half, but
educated
but
people here.
But a lot of people have no idea You know, they think every filler is one that disappears. And it's not true. One of the best fillers is one called Bellafill. Bellafill is a nice long-term filler. It not only improves the volume, but it helps to improve your skin at the same time. Plus, they went to the FDA and said, look at us not for 1 year, but look at us for 5. And they found out they were one of the safest fillers as well. Another long-term filler is body fat. And so everybody wants to get rid of fat, and you probably saw somebody having cool sculpting in the waiting area out front, and she's getting rid of fat within her stomach. But fat is one of the best fillers that we can use. And so, you know, looking at this lady here, we give her volume, and just by giving her volume, she can go out, she's presentable. By giving that volume, we raise the eyebrows, we raise the cheek, we give a softer jawline as well. And again, I could do this with many different fillers, from body fat to Juvederm as well. And when we do something like body fat, that's a procedure that can be done within the office itself or in the operating room, depending on the amount of fatty tissue we're going to place for you. And so, you know, people ask, they say, you know, well, why would I, you know, use my body fat? Well, when you look at fillers, you know, a cc of filler is 1/5 of a teaspoon. And 5 cc's, which is 5 syringes, is 1 teaspoon. Many people need more than 1 teaspoon in their face. And so it can become cost prohibitive for people if they're, you know, putting in 3 teaspoons, 4 teaspoons. But most people have a little bit extra body fat. And so that body fat, if it could be made into their own filler, can be used, and it also does enhance the face as well. And so actually, if we go back, that'd be great. So looking at the volume that we put in, you can see again, just adding back the right amount of volume can help. And this can be combined with other procedures. So those of you who know me know that I say 1 + 1 + 1 doesn't equal 3. It can equal 4, 5, 6, or more in regard to the changes. So I love combining procedures.
I hate to interrupt you, but that lady's had more than one procedure, correct?
That lady's had more than one procedure.
Because there's a huge difference there.
So she's had volume and tightening. And so you can see, you know, by adding procedures together, it becomes additive. And, you know, the healing period's basically the same. So when you add things together, it's like, okay, I'd like to have eyelid surgery. You know, can I have a facelift at the same time? You can, and the healing period's all at the same time, and there's a savings for you too, because it's one operating room, one anesthesiologist. You don't have to keep coming back over and over again. The beauty, again, of things like fat are that fat has these potential cells in it. So you may have heard of stem cells. Everybody thinks stem cells are just in their bone marrow. Well, 1 teaspoon of fat has more of these potential cells than bone marrow does. And so we can use your own fat for many different things, like rejuvenation of the face as well.
Does it last longer?
So the answer is it does last longer than some of the fillers like Juvederm, and I love Juvederm.
Or Restylane.
Or Restylane or Voluma. They're great fillers. So the person who wants, you know, the fill today, who understands it's going to disappear within a year's time or 18 months' time, you can't beat it as a filler. But fat is a living object, so it takes on a blood supply, and it continues to work within the area and live. I say that if I see it there at 3 months, it's going to be there for the next 30 years.
Wow.
Yeah. So it's something that really is an immense, really tremendous update as far as cosmetic surgery, the way we're doing fat now. And I say that because in the past when fat was done, it looked a little lumpy bumpy, but now it's more like a liquid, and I call it liquid gold, the fat, because it's so pure. Let's look at the next slide. And again, not getting rid of every line that's there, but, you know, making a change that her friends look at her and say, wow, you know, you look better. You look good. Next slide, please. So people come to me all the time for eyelid surgery, and not everybody needs eyelid surgery. So with eyelid surgery, what I do is I use a laser, And using the laser, not a scalpel blade, I can contour the lower eyelids without a skin incision at all, no stitches, no scalpel blade. I use the laser to contour that fatty tissue, and then the same laser is used on the skin to help smooth the skin. But again, everybody doesn't have the downtime, so I can camouflage the fatty tissue by using fillers. And so the area below the lower lid where it meets the cheek, I'll build up the cheek because the cheek's the foundation for the eyelid, and then add the fat underneath that area in what's called the tear trough, and that gives a smoother look to the lower lid area.
Do people know that you were the first person to use that laser procedure here?
So, yeah. So I'm not sure what everybody knows, but yeah, I'm the first person.
I think that's pretty remarkable.
To do that. I'm the first person to bring thermage for tightening of the eyes to Michigan as well, and I'm one of the procedures, the fat transfer called All Me. I'm the first to bring that to Michigan too, and it's called All Me because it's all you. It's your own fat and your own blood. And so I should probably explain that. Your blood, you may have heard of the vampire facelift. The Kardashians made it famous, and what it is when we take your blood through a special process, we end up getting the platelets, and platelets have growth factor within it. That I kind of think of as the fuel, if you will, to help with rejuvenation. And then your body fat, again, has these potential cells. So it's the kindling. And so when you put the two together, that's the All Me procedure, I can inject it in many different places, including the face, and I'll show you some other places too that it can be injected to help with rejuvenation. So this lovely lady had what's called the Y lift. Now the Y lift is a specific procedure that uses Juvederm and Voluma, and what it does is instead of just giving volume, it creates structure as well, so that the fillers are used deeper as well. So many people may not be aware, as you mature, as you age, you're not just losing volume because of volume within the face itself, but your whole structure of your skeleton changes or your skull changes too. That's why, when an anthropologist, finds a skull and they look and they say, hey, this person was 73 years old. Well, how did they know they were 73? It's because of the structure and how things change. So with the Y lift, what I'm doing is not just giving you back the volume, but rebuilding that structure with the same fillers. And this is a procedure day of and no downtime. And so here she is before and after, and looks great. Go out the next day. Next picture. Again, person right before, right after. And you can even look at her neck.
That's the biggest difference.
Yeah.
Right? The neck?
So even on her neck change, and there's no injections in her neck here. The reason that her neck changes is because I recreated the volume lifting for her. And it was enough lift in her cheek area, along her jawline. If you look at her jawline was coming really down to a V. And by giving her that volume back, it's more like a U, if you will, that helped to lift and recreate underneath her chin as well. And so no liposuction there.
That's a big difference.
Yeah, no stitches. And so, with filler, you can make some beautiful, beautiful changes that can put off the facelift if you wish. Next picture. So I was talking to you about the All Me. So, people come in and they have their face done and they're keep their hands underneath their armpits, and they wear these big turtlenecks because they want to hide their neck too. But these are all things we can continue to rejuvenate. And so the hands, this is the All Me procedure, where into the hand itself we can inject your body fat and blood to recreate the volume that you've lost, and it improves the skin tone too. There are fillers too, like Radiesse. Radiesse is one of the fillers that's been approved as well as a filler for the hands. And we can also then use light therapy on the hands to improve the collagen and get rid of some of the browns in the hands.
That's
and
what I
reds
was
as well.
going to ask, because as you get older, you see a lot of people, all right, just cover your hands. I see people who get those little age spots. And it's probably from exposure to the sun. Our hands are always in the sun. So that's one thing that you want to do, is kind of lighten up those spots or get rid of them altogether, because hands give away your age. First. Yeah. Right? So we want to fix those hands.
So So when everybody has a question, they're going to raise their elbow instead.
Right.
And you know, for all of you here, many of you have already had a consultation today, but the staff is here for you throughout the day. There is no rush. We're here for consultations throughout the day. And as part of our Patient Appreciation Day, we have some of the best packages, I would say of the year, but it's really of the past 20 years. And you'll be able to speak with the staff about that throughout the day. So again, this is an injection into the hands, and I get a lot, equally men as well as women, coming in for hand injections.
Really? See, I wouldn't have thought
Yeah.
that men think about their hands, right?
But the other thing you'd probably be surprised about, I get a lot of men who have injections in their lips.
Now that surprises me, right? Women, we want those fuller, lush lips, because when you get older, that's one of the things that shrinks. You know, your lips, they get thinner and small. Why is that?
So we lose volume, but the other thing that happens, there's one part of our face that truly elongates. It doesn't sag, but it elongates, and that's the space between our nose and the red of our lip. So that's the only part that really elongates over time. And so by recreating volume within the lip, we can decrease that space between
Shorten
the nose
the
and the
area
lip,
there.
shorten that. And by some beautiful work that my team and I do, we can tighten the area too, and it really rejuvenates the face to tighten that lip area.
Well, for women especially, how many of you notice when you put on lipstick and eat that it runs, the lipstick runs up into the lines, up and down? That's not great, right? So if you can eliminate that, sometimes it's just putting a teeny bit of filler on the lip line, not
That's correct.
necessarily, you don't have to puff up the inside. You just want to smooth those fine lines, especially if you were a smoker. And they also say drinking out of a straw a lot.
Well,
over the
good luck
years.
finding a straw these days.
Right. Well, maybe that's why they outlawed them.
So, you know, as far as the lips are concerned, so the lips are probably one of the #1 injectable areas that people request. And we truly give a luscious lip, and Juvederm is my favorite filler for that, because what's nice about Juvederm is Juvederm actually loves water. And because it loves water, it gives a fuller, luscious lip. And when it's placed within that line between the red and the white, it does help with the bleeding lines from the lipstick as well. Plus, especially in winter now, it hydrates the lip too. And so less chapped lips if you have filler within your lip too.
And also, a lot of women are afraid because they think it hurts. The first thing I hear is, oh, it's gotta hurt. But they numb it so well. I don't know from firsthand, but I've seen it. They numb it so well that you really don't even feel it. So you walk out with beautiful lips, and you don't even know you had it done.
So we actually have a few different options with that. One is a cream called BLT, not the sandwich.
I thought maybe you feed them while you're doing it.
And so what it is 3 different numbing agents that are placed around the lip area. And the second thing that can be used is ice. Power of ice is pretty amazing.
Well, it numbs it, doesn't it?
It numbs it very well. And third, if you really want, I can give like a dental block.
I'll take that.
And so the dental block just numbs the area totally. But with the dental block, you have to be careful, because when you go to your cocktail party that night and you're drinking your martini, it may just kind of fall out. So,
I'll take that chance. Okay.
so lip fillers are pretty amazing. So many of you saw before Angelica was out front having cool sculpting. And cool sculpting is a great procedure to melt fat. And the way it works is that the cold causes the fat to basically break up into little particles, and then your body gets rid of it naturally. And how was it discovered? It was discovered by people watching little children with ice pops. And they would keep these ice pops in their mouth, and they'd be sucking on them and sucking on them, and they realized the little kids were losing fat in their cheek. It was that, and also from people riding horses in the winter, and the exposure of their backsides to the ice and to the cold, and they realized that they lost some fat in those areas too.
So we actually look
so
better in
jockeys.
the winter than the summer,
Yeah.
I guess.
So it took some Harvard scientists looking at that, and they said, okay, we're going to freeze the fat, but we don't want to harm any surrounding tissue. So they figured out how they can use this machine called cool sculpting to bring the fat close to the cold without harming the skin. So the skin, there's no frostbite. You sit there and the fat basically is gently pulled into, by suction, into this case, and the cold then works onto the fatty tissue, numbing it. And if you saw Angelica, it was a true procedure she was having done there. There is no discomfort. She was on her phone, she was talking to people, and then the fat breaks up over the course of the next 6 to 12 weeks' time. There's a second procedure that we have in our West Bloomfield office called Sculpture. And the difference between the two is Sculpture is a laser. So the laser points directly to the fat, doesn't touch the skin at all, and breaks up the fatty tissue. And that's a nice procedure too, because that procedure takes around a half an hour. Cool sculpting used to take an hour, but now it's closer to 40 minutes. So they're two great procedures. And we, speaking of firsts, we were the first ones in Michigan to combine it with other technology. So we combine it with radio frequency to help tighten the skin. So procedures like Exilis or Venus Viva or Thermage can be used after the procedure, because these procedures don't tighten skin. And so when you combine it with skin tightening procedures, you get the loss of fat, and it's guaranteed you'll lose 22 to 25% of the fat with the procedure, and then you get the skin tightening.
Is this a replacement for lipo?
It's not a replacement for liposuction. I still perform liposuction. I do it in a different way than many other doctors. So many doctors, you've probably seen video or pictures of this cannula that goes back and forth. And it works very well, but the cannula, you're making faces, yeah. So the cannula itself doesn't just break down the fatty tissue, it can harm surrounding tissue too. So I use something called a body jet or a water jet. And what that does is the water jet breaks down the fatty tissue. It doesn't harm the surrounding tissue. And the fat, when it comes out, again, I call it liquid gold, because that fat can be used directly into your hands or face to give you back the volume that's there. And because I use this body jet, we contour the body better. With these procedures, they get around 22 to 25% reduction in fat. With liposuction, you get at least 50% reduction, if not more.
What's the price differential?
So
how much more is
So
one than
it's
the other?
about, this is about half of what liposuction is. But you don't have to go to the operating room here. There's no downtime for you here. You get back to your regular activities right away.
Is it painful?
So this procedure, cool sculpting, is not painful. And I can tell you honestly, I've had both procedures done. So cool sculpting, when it first goes on, you say, wow, what's that? Feels a little weird. And then the area goes numb. And then you're fine, and again, you're on Facebook saying, look what I'm having done.
So that's great during a lunch hour or when you don't have a whole lot of time but you want to look better. You could do that right before a big event, like
You
if
could
you had
do
a
it
wedding coming, you want to slim down and fit into a certain dress.
Yeah. But people who come to me before big events, don't come the day before.
Well, not the day before, especially, I love the ones that say, I have a wedding coming up, I'm going to get injections. Bad idea, because you can get a little bruising, you can be a little sore. So you got to give yourself a good week or so, right?
You definitely do. You definitely do. And sculpture is different than cool sculpting in that you feel cold and then heat and then cold and then heat. And if the heat ever becomes too intense, you just let us know and we can give you a blast of cold air as well. And so it's very tolerable. Let's look at the next picture. And again, the stomach, the pooch, and then just tightening with cool sculpting or sculpture, and then tightening the skin as well.
Well, I think the interesting thing about that is a lot of people who have that little extra weight think if I go to the gym and do a lot of crunches, a lot of sit-ups, I can tighten that. That has nothing to do with your skin. You might tighten the muscle, but there's still excess skin. So no matter how much you work out, you can't get the result you want without a little help. It's not cheating, really, is it? No, we're just being a little smart.
Let's look at the next picture. So this is one of my favorite newer procedures. This is something called J-plasma, or now called Renuvion. And what it is, it's skin resurfacing. And it's skin resurfacing that causes tightening as well. Now you notice not every line has disappeared.
Well,
but
how old is that patient, would you say?
I don't remember her exact age, but in her 70s, but I don't remember exact. And she had a lot of sun damage, and so we reversed the sun damage for her. And she actually, this picture was taken like 4 weeks after, and seen her since, and she actually looks even better than that now. It's something that will improve even up to a year afterwards. And this is a great procedure, but this is a procedure with downtime. This is a procedure where I'm seeing you every 2 weeks to get things under control and make, excuse me, I'm seeing you every day for 2 weeks, I should say, to make sure that your skin is healing well. But it's a great procedure. And if you look, again, she has tightening where she didn't have a facelift. This is just the resurfacing for her, and no volume was added as well. This is just the one procedure on its own. Next picture. So this is one of my favorite procedures. This is, if you look along her jawline, and you can see the tightening underneath her neck as well. This is a procedure called my laser lift, where I make, excuse me, a tiny incision here, here, and here, and then I use a laser underneath to tighten the skin, to melt the fat, and to tighten the same muscle I would do in a facelift. It's not the same kind of tightening as you would get in a facelift, but you have very little downtime, maybe a day or two with it, and we get some beautiful, beautiful tightening. Next. And so with body, you were asking about liposuction. So this picture is not photoshopped. This is a person that I did liposuction on a year ago, and I used the J-plasma we just spoke about, or Renuvion, that I use on the skin. I use underneath the skin to help tighten the skin at the same time. So not only melting the fatty tissue, but tightening skin too, and it really creates just a tremendous change for people. And so when you ask, you know, could cool sculpting do this? Cool sculpting wouldn't get to the same degree as liposuction.
Can you do 3 or 4 cool sculptings and then get the same result as you would
So
from
I find that
lipo?
cool sculpting and sculpture works best if you do 2 rounds. So you do 1 round and a second round around 12 weeks apart, and those people, along with the skin tightening procedures that we add on for them, really makes a beautiful, beautiful change. So I think next what we're going to do, I know we have 2 people who would like to talk about their experience.
I love that.
So we're going to bring in a chair and have them come in.
We're back, and we have a special guest who's going to tell us about her experiences. Dr. Berkowitz, why don't you introduce your patient and friend?
So Loving Patty had a procedure less than a year ago, and with her procedure, she had multiple things performed simultaneously. You want to tell everybody what we did for you?
Sure. I had QuickLift, and I had, along with that, I had deep laser resurfacing, and I also did underneath the chin, I can't say it.
Liposuction
and I also had
she had
it's another
tightening it's called cementoplasty, so we tighten
Yes.
underneath her neck as well.
and and then I had my lips also done, which was great.
And it didn't hurt that bad, right?
Well, I was completely out for the
best.
procedure.
So upstairs we have 2 certified operating rooms with a board-certified anesthesiologist, and so everybody's safety and sterility are very important, and so I don't perform these procedures downstairs where I perform filler alone, so this was done in the operating room for her.
Right, and I really don't think I had that much downtime, for my experience anyway. You know, I mean, the first day, of course, was like, I was still kind of out of it from the anesthesia. But it was kind of neat because I felt like my mom, who's passed away, was with me. And I'll tell you why, because like when, I don't remember this, but when we got home, I told my husband to back all the way up the driveway so that I could get out and come in the back door of the house because I didn't want my neighbors to see. Because my mother had a facelift, and my mother did that's why I did, because of course, oh my God, yeah.
She was ahead of her time, right?
Yeah. So, but like I'm more open about things than my mother ever would have been. And so it was kind of cool, that I was told that I did that because I don't remember it. But 2 weeks out, I thought I looked fantastic. I was just like, I had a regular doctor appointment, and I walked in that office, and everybody was like, "Oh my God!"
That's what we hope for. That's the reward.
They didn't really. They were like, "Oh my God, you look fantastic!" I had such a little bit of bruising. Like unless you looked really close up at me, you couldn't really see it. Right away, and I still had a little bit of swelling, so, it was like I was totally wrinkle free, completely, because I still had some swelling, and it was just fantastic. It was like, and I mean, I still look really good, I think.
Do you say you do? Do you say your age?
Oh, well, I like to mess around with people, so. Like if I tell a young kid, yeah, I had my facelift, did you know I'm 103?
Right.
But I'm 62, and but I think I look much younger than that. So.
And the good thing is you started at an age where you'll stay looking good for a long time.
I hope so. I think I look like at least 10 years younger.
I mean, if you look at her picture from before and now, and I hope you all think she looks naturally
beautiful.
Fantastic. I mean, you wouldn't know that she had any work done. And that's the whole idea. She looks beautiful.
Yeah, I thought you were in your 50s, and so if you can lop off 10 years, that's a gift, right?
Yeah. Well, thank you so much. I appreciate it.
Thank you for having me.
I think we have some more questions. Do we have time for some more questions?
We actually have one more testimonial.
Well, let's
picture.
do that first then.
So, Paulette, can we show Paulette's
Oh, don't.
Oh, okay, good.
But that's why I came here.
Another beautiful lady.
Oh, yeah.
Mm-hmm.
Look like my mom.
So that's what people, they come to me and they hold up the mirror and they say, I look like Mom, I look like Dad, and that's why they're here. That's what brought them in.
Right.
So what brought you in?
Well, what really started it were my eyes. I am Polish, 100%, and my mom, you can tell, we have those Polish puffy eyes, and my eyelids were drooping. And I come here for my eyes, my appointment, and Dr. Valley John said, Paulette, do you realize that when you look, you open your eyes like this?
You're using your brows to
Right,
raise your eyelids.
to open. And he says, you may want to. And he says, doesn't everything seem dark to you? And I went, yeah, it does. So he said, why don't you see Dr. Berkowitz? So eventually I came over and we had a consultation about that. I see the biggest difference to me are my eyes. I mean, the rest of it is great, but when you have an eye lift, and I've been in cosmetics for most of my life, you use dark to hide anything that you want taken back. The biggest difference that I found was that I put my makeup on differently, because I didn't need to hide all of that. So when you go to the aisles of beauty and they have all these light colors that most people over 40 should use, I can use those now. But of course, at the same time, I had the QuickLift, I had liposuction. What made the biggest difference in me, besides Dr. Berkowitz, was the staff. I can tell you, the staff is by far where you go to for your support. Dr. Berkowitz comes in and he sees you to make sure that you're okay and things are healing way that he wants it to progress, but the staff are right there for you, and they're right there for you if you want to, if you have a question or such, and gives you product, and but I am so happy with it, and I brought my friend Alana here. And I mean, I am so happy, and I'm happy that all of you are here because you're in the right place.
Well, thank you.
Okay.
Thank you so much. And that's the way we grow, is by friends telling friends. And so please tell your friends about us. Tell your friends on Facebook about us. Tell your friends on Twitter, whatever social media. Look at your picture. It really helps us to help others. And that's why we continue to grow and continue to win these awards, because of the fact of people like yourselves who help us to expand.
Right, and I feel like you and I are kind of twins. It's the same kind of thing, you know. It's like
It's kindred spirits.
right, and
With
and you
other
c-
people who've had things done, you kind of have that shared sisterhood, right?
And same kind of thing. And I'm 65, and when people look at me, they go, "Wow!" And my hairdresser, everyone just went, "Wow! We know you had something done, but it's not like a drastic change." And it should be like they said, it's a natural change. So we're all in the right place.
And the
that's what's great.
nicest thing is how you feel about yourself.
Absolutely.
Because the better you look, the better you feel. Because people judge us, unfortunately, by how we look. So when you feel that you look better, don't you wake up every day with a better attitude, and you want to go out and get those compliments?
Right, and this is the first thing that everybody sees, whether you're working or you're a grandparent or a parent. This is what everyone sees. And like we were talking about earlier, you could go and buy the most beautiful, $300 sweater, and people won't even know that. But this is what you sell. You
You're
sell
so,
this all
you're
the
so
time.
right. Because I see these women that wear turtlenecks thinking it hides it. It just pushes it up. And then you get that hangover where the skin is hanging over the turtleneck. Not a great look. So,
Yep, I
you
totally
can run, but you can't hide. So
That's
you
right.
got it.
Might as well
Fix
just
the
pull it up.
problem, right? Fix the problem,
That's right.
and then you're happy. Well, I think the most important thing is to see your smile. You're the perfect example, both of you,
Oh, yeah.
of why Dr. Berkowitz does what he does. Besides that he loves doing it, he likes to see the patients come back with that smile
Right.
and with their stories of the compliments that they get from their family and their friends when they see them and say, "Wow, you look beautiful. Who did that?" And you
Well,
can tell them.
My family took care of me, when I came home, and it's something to go through. But somebody said, my sister asked me, "Would you do it again?" I said, "In a minute. In a minute. I don't have to, but in a minute I would do it." Absolutely.
And I think that's the best testimonial, is that if you could do it again, you would.
Oh yeah.
So
most definitely.
we want to thank all of you for being here. Yes.
I have a question, and I think it's very important. I find it interesting, and actually, they don't address a lot of pricing and affordability, which this day and age, as we progress, and it's we have more and more knowledge of product and how we can change ourselves, how we make ourselves better. I think it's more affordable. A lot of people are drawn back from it because they don't understand that it's not anymore for the super wealthy and the super rich, and that is actually accessible to us.
Yeah, my staff's pretty amazing to help you with financing.
To navigate that, and even non-financing, and I think that's a lot of drawback from that. A lot of more people would reach out
Right.
to it.
Mhm.
A lot more people would have more procedures and would have things done to uplift them.
Well,
But-
you look upon it as an investment in yourself.
It's 100% an investment in
It's
yourself.
you, and it's you and no one else.
Yes, it is. And it's also, like I said, it's actually very, very good. It's not as it used to be years and years ago when a lot of people could simply just not walk in and then ask for certain procedures to be done. I think it's a great way right now to make yourself look good and not be worried about potentially having to have a setback financially. Because I
Right.
think everybody can do it.
Well, I think that's the key to it. It's pretty painless. it's affordable, and I think that women who care about their looks should put aside a little bit of money every week or every month in their little kitty and save it up for the procedures that they want. Anyways, I want to thank all of you. We're going to say goodbye for this segment, and we will be back again like we always are next week. Thank you so much.
Thank you.